Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a physical therapist assistant. Our guest today is Dr. Datis Kharrazian. Dr. Kharrazian is a Harvard Medical School trained and award-winning clinical research scientist, academic professor, and world-renowned functional medicine healthcare provider. He develops evidence-based models to treat autoimmune, neurological, and unidentified chronic diseases with non-pharmaceutical applications. His clinical models of evidence-based medicine are used by several academic institutes and thousands of healthcare providers throughout the world. Dr. Kharrazian is an associate clinical professor at the Loma University School of Medicine. So without further ado, here is Dr. Kharrazian. Welcome, Dr. Kharrazian, to the podcast.
Thanks, Mike.
So would you mind telling us a little bit about your background story?
Oh, sure. Yeah. So I got into alternative healthcare and then eventually into medical research just by growing up and having family members that were sick and seeing how they were treated. And they ended up getting better when other practitioners failed with really just doing clinical nutrition, lifestyle medicine. And the people that were doing that at the time were, mostly chiropractors, naturopathic practitioners, and not really the conventional MDs. So I really had that attraction to that. And then I was into sports medicine a lot. So I went into chiropractic, and then I realized I really need to learn about nutrition more. So I got my master's degree in nutrition. And then I realized I really need to understand research. So then I went back to school, got my doctor of health science. And then I realized I need to learn more about research. So I got my PhD with a focus on immunology and toxicology. And then I got to spend 6 years at Harvard Medical School doing research. And then while I was there, I did a master of medical science in clinical investigation, and really focusing on autoimmune disease and how diet, nutrition, and lifestyle applications may change the expression of autoimmune diseases.
You are a very ambitious man.
Yeah, you get interested in one thing and then you get an opportunity and you go, wow, I'd really like to learn this. And then, learning research is a whole different thing, and it's you can't just be a physician or healthcare practitioner and understand research. You actually have to have real training in research to understand how study design works and inclusion exclusion criteria and flaws with research, and it's a real thing. And what I really realize is the majority of physicians, healthcare practitioners do not apply current medical research. They don't read the research, they don't understand the research, and it's even worse with alternative medicine. And then we have a lot of confusion, and we have practitioners that are searching for education to know what to do, and we have patients searching for right things to do, and then you get all these weird theories, and then you get over-dominant pharmaceutical industry, and then a patient who's got a chronic disease just stuck and not knowing what to do. And then you have all these different theories on the internet. And, there actually is a lot of good research published and really effective applications people can make to really manage their chronic disease. And I think that's really been my focus, is to try to share that with people.
That is quite the educational background.
Thank you.
All right. The first topic of discussion is Hashimoto disease. So what is it, and what are some ways people can try and treat it?
So Hashimoto disease, for most people, they just think hypothyroid, like, is your thyroid working? And everyone at some point may have known someone who's a diagnosis of hypothyroid, or someone's taking thyroid medication, and maybe runs in their family. And basically, it's hypothyroidism is really an autoimmune disease. And most people that get diagnosed don't really know that. So hypothyroidism just really means your thyroid gland is not working. When your thyroid gland is not working, and you can start to have slower metabolism, can have really bad circulation, cold hand, cold feet. You can start to have brain fog. You can start to have hormonal imbalances. And these hypothyroid conditions typically turn on in females more than men. Strong proponents of females that age 40, 35. Now it's even getting younger. And then all of a sudden, you have a person who's been healthy their whole life, and all of a sudden everything's going the wrong way, and they're frustrated and nothing makes sense. And they finally, read online, they have a lot of symptoms. Maybe it's constipation as their initial symptom. Maybe it's just really dry hands and skin. Maybe it's fatigue, and they finally get evaluated, and they, probably beg their doctor to get a thyroid test. It's not part of conventional testing, which is a shame. And they finally they're diagnosed with hypothyroidism. What they don't know is that really what they have is Hashimoto's disease. And the reason they don't know that is because you would have to do a test called an antibody test to determine that, called TPO and thyroglobulin. And it's just not routinely part of the insurance model. So when you get diagnosed with hypothyroid, there's no point to do it. because they go, 95%, 90% of people have hypothyroidism, Hashimoto's. Why would we spend the extra $400 to do this antibody test? It doesn't make sense in insurance model just to waste money for no change in treatment. So when someone gets hypothyroid diagnosis, they basically are told, come back every single year and we'll see if your medication is, enough for you. And what they basically don't understand is the guidelines that the Endocrine Society had put together for hypothyroidism was you're going to have your thyroid gland destroyed further in the next year. Your immune system is going to continue to destroy that gland. And the dosage you have now may not be enough. So let's have you come back in a year and see if that's enough of the dosage you need to manage your symptoms. And, and for some people, they have the thyroid destroyed 3 months after the appointment, and they're going 9 months without having that replacement, the right amount of replacement, and they're gaining weight and having depression, all these symptoms. And, it's not time for your annual thyroid workup. A year is just a random number someone put together just because it correlates with the annual physical exam. So the fact is that many women and some men, but mostly women, that they get diagnosed with hypothyroidism, because it's a female predominant disease, they're frustrated because they're not being managed properly. First of all, they don't know they have an autoimmune disease. Second of all, they're being told to come back once a year to make sure the thyroid hormone the dosage is correct for them. But that's just a random number of people put together. So once a person develops Hashimoto's, they really have an autoimmune disease. Their immune system is attacking their body, and it's typically not just the thyroid gland. And then there's a web of dysfunctions that take place when someone gets hypothyroidism, which is really Hashimoto's disease. And one of them is there's a gene uniqueness. So some people get gluten sensitivity. They start to react to foods. They start to lose what's called immune tolerance. So they start to develop food sensitivities to many foods. Now, for the first time in their life, they're reacting to foods they never reacted to before. Most common ones are going to be wheat and dairy. They get really bloated. They get really swollen. They get really inflamed. And they even get brain fog. They start to eat those foods. They start to have chemical tolerance issues where their immune system can't tolerate chemicals as much, start reacting to various chemicals. They may be like sensitive to certain smells and being around perfume, or it varies from one person to the next. And as they continue to this web of dysfunction that takes place with Hashimoto's, they get brain inflammation. These Hashimoto's patterns turn on inflammatory mechanisms that turn on the immune cells in the brain called microglia. So now they have brain fog and can't think and can't focus, and they get depression. And these inflammatory models of depression with Hashimoto's, they don't respond to antidepressants. It's not a neurotransmitter deficiency. It's a brain inflammatory response that's involved. So then, they're frustrated, and then their gastrointestinal tract becomes less efficient from the inflammatory responses. They get intestinal permeability. It's part of the vicious cycle of it. And they kind of go down this vicious cascade where now not only is their metabolism an issue, but their hair is falling out, their circulation's off, they have brain fog, they have depression, everything they're eating is causing bloating, distension. And they go back, and then maybe they'll have their physician go, hey, maybe you need an antidepressant. Here's an SSRI, or here's Wellbutrin, here's Prozac, or something like that. Oh, it didn't work. Let's try another one. Before they know, they're on a list of other medications for that. And then for every little cheap complaint they have, instead of treating underlying autoimmunity, they're using a single drug for a single symptom. So now for their bloating, they get another medication for their, for their depression, for their, gallbladder symptoms. They may get all these other issues. And when people have Hashimoto's, there's other autoimmune diseases that start to get turned on too. So many patients with Hashimoto start to get like pernicious anemia, B12 anemias. They get antibodies against the protein that carries B12 across their intestines. That happens about 5% of Hashimoto's people. Many people with Hashimoto's get antibodies to their actual brain, and specifically in an area of the brain called the cerebellum. They start to get dizziness and vertigo and nausea, and they become the weird patient, right? They become this weird patient in the healthcare that is now frustrated, that has gone from like one department head to the next department head, and they don't know what to do with them. And the patient's completely frustrated. And this is actually the first book I ever wrote. First book I wrote was, why do I still have thyroid symptoms when my lab tests are normal? And I went into like, hey, the science actually shows that you actually have an autoimmune disease called Hashimoto's. No one's telling you that because running the antibody test to confirm it is not part of the routine healthcare system. You can easily do it yourself and see you have it. And you really need to manage this from an autoimmune perspective. And then when we walk into the medical healthcare system, there is no autoimmunologist, right? we have a cardiologist, we have a nephrologist, we have a psychiatrist, but we don't have an autoimmunologist. We have a rheumatologist for joint diseases, but not for these complicated autoimmune diseases. And then the endocrinologist will just say, hey, you have an endocrine disease, we'll just do what we always do. We're going to manage your hormones, but they don't really know or know what to do with the autoimmune part of it. And unfortunately, there aren't very effective drugs for these autoimmune diseases. There's just severe immune suppressive drugs like cortisone or what they call biologics, which shut down the immune system. And so there's a level of frustration people have when they go through this path of Hashimoto's. But diet, nutrition, lifestyle can make a huge impact on it. Well published in many, many papers. And they just don't know what to do. So they're frustrated and they're confused. And it's like, the gene type of Hashimoto's is very common to have an HLA-DQG type. It's a gene type 2 and 6, which many people with Hashimoto's have. That makes them very sensitive to gluten. So some of these people that finally learn, hey, I'm going to go adopt a gluten-free lifestyle. And maybe 30% of their symptoms go away. For some people, maybe it's greater. There's even studies published that show in clinical trials, they have a subset of their patients completely go into complete remission with no symptoms after doing a gluten-free diet. Sleep makes a huge impact on autoimmune disease in general. Sometimes just understanding how important sleep is for the person who's got Hashimoto's, and they really get into a regular schedule and really focus on getting good sleep instead of being on their phone all night or being on the internet all night and not getting much sleep and trying to get up too early. Their immune system starts to calm down. And, they may start to take some things to support their gut immune system and the gut barrier, maybe some nutraceuticals or things to help them digest their food much more efficiently. And all of a sudden their gastrointestinal system is functioning better. And then these little steps, as you start to add them up, can put a person into remission where they feel a lot better. They're not cured. This isn't like a quackery, alternative medicine. Medicine can't cure you, but these vitamins can. It's not about that. It's like you have an autoimmune disease expression. You have certain genotypes. You have certain susceptibilities. Various lifestyle, dietary factors can change how they express. So let's work on what's current and let's see if those applications work for you. Like another common gene uniqueness that people that have Hashimoto's disease have is they have vitamin D receptor site polymorphisms, which basically means their vitamin D receptors aren't very efficient. So they need much higher levels of vitamin D than the average population. So they may need to get their vitamin D levels like above the 50 range on a lab test versus 25 range or something. And then vitamin D is a very powerful immune modulator. So they can start to take some vitamin D and maybe notice they have some improvements in their quality of life. So that's where Hashimoto's comes in. And that's been a big part of my focus, because when I was looking at having interest in diet, nutrition, lifestyle, and what people with chronic disease like autoimmune disease can do, obviously I had touched on Hashimoto's because it was the most common one. And many people are out there. And the current statistics show 1 in 12 women in their lifespan will have autoimmune disease turned on. And doesn't mean they get like a full-blown rheumatoid arthritis, multiple sclerosis, but they start to make antibodies against their own tissue. And the most common one, the most prevalent one in females is Hashimoto's. So all that people, yeah.
Is there a reason why it's more predominant in females and males?
Yes, when you look at autoimmune diseases, there's a whole area of research where they're looking at autoimmune disease in males and females. And there's some autoimmune disease that are exactly equal with male and female distributions. One, like type 1 diabetes, just as many men and just many female get the same disease. For some diseases like Hashimoto's, it's for sure like 90% female, 10-20% male, and no one really knows. Obviously the biggest theory is just hormones, reproductive hormones, sex hormones may play a role, but no one's really identified the exact mechanism, and it's still an area of investigation and research. They can just map out and tell like which autoimmune disease have a greater preponderance for males or females, and Hashimoto's is for sure the most expressed in female autoimmune disease in the world, and the most common autoimmune disease in the world.
So in your book where you talk about, what is it called again, on thyroid?
Oh, why do I still have thyroid symptoms?
Yeah, I know in your other book, Why Doesn't My Brain Work, you kind of have dietary rough guidelines. Are those in that book as well?
Yes. And, so that's this thing too. People sometimes get frustrated. There isn't an exact protocol for every person. You just have to understand the concepts, see which concepts apply to you. But I mean, I try to get the information out as much as I can out there in books. Also on my website, Dr. K News, I have a lot of articles. I have some online programs to teach people suffering. going through the steps of what they need to know and how to apply some of these strategies to their life, right? And that's the problem because, I've spent over 20 something years teaching postgraduate education healthcare professionals. What happens is, there's just the ones that really understand it, they all end up with waiting list practices. No one gets to see them, and they're, not cheap because they incorporate a model of diet and lifestyle that insurance companies don't cover. And then there's not enough of them around because not many people want to practice. It's a very hard way to practice, to sit down with someone and do a detailed history of their diet and their lifestyle and what the factors are in new labs, and then develop an individualized, personalized medicine approach is tough to do. So I think what's happening now is just people need accurate information from evidence-based research, and then how to apply that into their life, then how to find out what's unique for them. And then everyone has to go through their own experiment. Like some people that have autoimmune diseases will be very, very sensitive to lack of sleep. Some people with autoimmune diseases will have a severe issue, not so much with sleep, doesn't really flare up their autoimmune as much, but it could be with dietary proteins. Someone else could be very, very sensitive to chemicals. Someone else could really have their autoimmune disease flare up when they get like common cold, and they have those issues. So some people can have their autoimmune disease very, very, very much expressed when the gastrointestinal system is dysfunctioning. When they have things that disrupt their gut microbiome. Maybe they went on antibiotics, or maybe their diet was just bad for a while and their autoimmune disease really flared up. So everyone's a little bit different. So there's not everyone that has even with the same autoimmune disease, has the same dietary and lifestyle mechanisms that work. And this is where the whole world of personalized lifestyle medicine comes in. And this is another area of research which is very difficult, because when you look at medical research is focused on this concept of developing the best evidence. And the best evidence is for sure from a randomized, double-blinded, placebo-randomized clinical trial. That's how you really know something is working compared to a group that is everything's the same except the intervention for a period of time, right? That's the best design. But when they do randomized clinical trials, the other goal is to have generalizability, that it's as generalizable to the whole population as much as they can. It's not individual. And autoimmune disease is all about individuality. It's not really so generalizable. Now, certain things like just shutting down the inflammatory response in autoimmune disease works when they do clinical trials with different types of medications that way. But when you have one group of autoimmune disease people that have extreme reactions to certain dietary proteins versus other different patterns and have various uniqueness to different variables that are involved, it gets really hard to. You can design the study. It's just that when you try to look for what's called statistical significance, you need such a large sample, and it just doesn't become feasible, and no one's funding it. And this is the problem. And then the other key thing is, with one person that's autoimmune disease, in their life process, things can change. They can all of a sudden react to different foods. They can all of a sudden have sleep be an issue that's triggering their autoimmune disease that it wasn't before. They can have other autoimmune diseases turn on. So they start with Hashimoto's, now they have some MS, multiple sclerosis type patterns that are starting to express, or they start to get inflammatory bowel disease, like an IBS, Crohn's autoimmune disease against their gut, and then they may be more sensitive to some dietary triggers that they weren't to before, some lifestyle triggers they weren't to before. So it's like a dynamic, ongoing thing. It's being done in research circles with what are called N-of-1 studies, where they're looking at multivariables and doing what's called Bayesian statistics to evaluate them. But it's still a new area of research, and they're still trying to figure out how to do it. So when you have like people that don't understand research, like let's say an older generation MD that's just doing what they've always been doing, they go, I don't read anything besides randomized double-controlled studies. And you're like, well, you can't answer every study design question that way.
Right.
And it's like, dude, you just get away from my world. You're like, don't even understand what But at the end of the day, people are suffering, and then these people can be authorities, and like, alternative medicine lifestyles. There's no evidence for that, and it's like you have no idea what you're talking about. And then the public suffers, right?
All right. Let's get into talking about the gut-brain axis. What is it?
Yeah, this is a major area of research. It's exploding. There's even journals now focused just on the gut-brain axis.
Right.
And basically what it is the GI tract impacts the brain. And, the problem is the whole body, maybe part of the body impacts each other. But when you look at how the human body was taught, human physiology was taught, they started with just what they visibly could see. They could see a big liver. They could see, then you have your hepatologist. They can then see a big gut, gastroenterologist, and there's a heart and the cardiologist. And they kind of got segmented by visual gross anatomy is how different medical specialties got put together, right?
Mm-hmm.
In reality, like there's cytokines, messengers, prostanoids, prostaglandins, hormones, all these signaling agents that impact all of these systems together. And if you were to train physiology now, I think if you started from signaling molecules, right, first, then you wouldn't have all the subspecialties we have the way they have. We have them, but oh well.
Yeah.
Right. The generations before that changes. But the key thing is different systems impact each other, which is very, very clearly understood. When you look at these messenger systems instead of gross anatomy organs. So there's a lot of messengers from the gut that directly impact the brain and vice versa. So the gut has bacteria, right? And these bacteria collectively are called the microbiome. And the microbiome, these bacteria, they produce things like what are called lipopolysaccharides. They actually produce hormones. They actually produce things like dopamine, serotonin, neurotransmitters. They produce gut peptide hormones like CCK. So these bacteria in our gut are not just bacteria for no reason. They're actually metabolically active, right? And when they look at the microbiome and they look at the gut, there's been a human microbiome project and a huge effort in studying the microbiome in the past 20 years. They haven't found like the perfect good bacteria, but what they have consistently found across all types of research is how diverse your gut microbiome will determine better resiliency to be healthy than unhealthy. So the more bacteria species you have, the more potential you have for these bacteria to balance you out when things go wrong. So some gut bacteria will produce dopamine. Some gut bacteria will produce an anti-inflammatory messenger. Some gut bacteria will produce a gut peptide, right? So more diverse your gut bacteria is, diverse your microbiome is, the more as your body shifts where things go wrong, they can come in and balance things out. So the microbiome in the gut is an area of tremendous growth in the research world of understanding how it impacts your body. And part of it is the brain. So what they find is there's these bacteria, these, they call them postbiotics, these messengers. The bacteria produce something that's called a postbiotic, these messenger systems that then impact the brain. And they can impact mood, like certain probiotics, even taking some probiotics yourself or at some point. Certain probiotics impact mood. They're now in the field called psychobiotics. And the gastroenterology researchers, an entire field of researchers that are now just psychobiotic researchers. All they do is study psychobiotics.
That's a very interesting term.
Yeah, very interesting term. And then there's people that are studying the microbiome or just looking at something called lipopolysaccharide. And like gram-negative lipopolysaccharides create inflammation all throughout the body. And then there's another variations of this, like lipopolysaccharide A. In animal studies, is showing it's curing autoimmune disease. Like they can cure animal models of autoimmune disease when they increase lipopolysaccharide A. It turns on what are called regulatory T cells, and animal models of MS are now going into remission. And it's like, wow. So this is part of the gut-brain axis, is how the gut impacts our health. But when there's a gut-brain axis, there's a gut-liver axis, right? There's a gut-pulmonary axis, there's a gut joint axis. There's all these different axes as these systems arise. So that's the gut-brain axis. And ultimately, it's like your gut has to, in an ideal scenario, to have the most efficient gut-brain axis. You have as diverse of a microbiome as you can have. And then I can tell you about things that can help diversify the microbiome that we understand now. And then it's not like taking a probiotic; it's more complicated.
Yeah.
And then you have to have your gut have tight junctions. So there's that thing called leaky gut. You have to have intestinal permeability. Your tight junctions of your gut have to be closed so undigested food can't cross. And you have to have what's called immune tolerance in the gut. So there's different types of immune cells in the gut, like that are called regulatory T cells and dendritic cells, and they have to not overreact and have to have a proportional response. And there has to be something called secretory IgA, which is an immunoglobulin that coats the gut and prevents for exaggerated immune response to take place. Those all have to be there to have the healthiest gut. And if you have that healthiest gut, not only is it going to impact your brain function, is what this research is showing, but it's going to impact Hashimoto's disease, like we talked about, inflammation, autoimmune diseases. There's a lot of strong links now in research to why some people get long COVID because of their microbiome dysfunctions and some of these mechanisms that put them at risk. So it's very fascinating. So the gut-brain axis is really just looking at the gut, but really how it impacts brain. And when the microbiome and all these things go wrong, they've been shown that it can cause depression, it's shown it can cause anxiety disorders, basically everything. It shows it can cause autoimmune diseases of the brain, like multiple sclerosis, um, and those are the relationships. Now, there's also a brain gut axis, which is another group of researchers and another group of journals that published on that, and they found the brain actually impacts the gut.
So it can go either way.
Either way. So
Huh.
the brain has a pathway to the gut called the vagus nerve. So the brain goes into the brainstem. There's a branch called the vagus nerve, the wandering nerve that goes directly and innervates the gut. And this vagus nerve controls autonomic function of the gut. Autonomic function being things like getting blood flow to the gut, causing you to contract your gallbladder so you can release bile to digest fats, causing release of digestive enzymes so you can break down your foods, activating neurologically the immune cells in the gut to kick in so you have good immune function in the gut. So lots of studies show people get head trauma, they get disruption in their brain gut axis, and even within 2 or 3 hours in animal studies, they can see they get leaky gut, their gut gets inflamed, their immune system in the gut disrupts. They can see relationships between neurodegenerative diseases having impaired brain gut axis issues. So it's like this interrelationship between the gut brain axis and the brain gut axis that's involved. And you have people that have like a traumatic brain injury. Maybe they were in a car accident, maybe lost their consciousness, or maybe they were young, they played football and were unconscious, and they injured their brain. And they didn't notice anything then. But 5 years later, 10 years later, 15 years later, now they're getting the expressions of it. This is what's called a post-traumatic encephalopathy, which is a term used where the brain gets injured and the inflammation continues to grow like a forest fire. And over a period of years, enough neurons are injured and damaged from it that there's some symptoms that are expressed. And one of the symptoms people will express, besides like it's cognitive decline or depression or mood changes and all things that come with it, is their gut doesn't work. Now they have this chronic constipation. Now they have these chronic DHI issues. They have chronic bloating, and they can get some relief with changing some things in their diet, but it's really a brain gut axis issue. I talk about that in my brain book. Why is my brain working? I have a whole chapter on the brain gut and gut brain axis and how to clinically, how these things evolve. But like these things are all real in healthcare. Like these are all known in the scientific literature. These aren't like made up theories. These are, how the body works, physiology. But people then suffer from these dysfunctions. They walk into healthcare and they don't know what to do. It doesn't
Yeah.
matter if they walk into conventional alternative. They walk into alternative, they're going to give them a probiotic. The otherwise conventional, they're going to give them, I don't know, stool softener or something like that. Or and this is the frustration. Like as an outsider looking in, I go, oh my god, people have no chance. Like literally have no chance when they
So
start to get.
you offer like different programming courses on your website, right?
I do, and it's an attempt to serve some degree of it, but it's not like I don't have all the answers. I'm just trying to get some reliable information in a digital format out to people that may help to some degree. Really, what we need is greater adaptation of research into clinical practice. Like that's what needs to happen. We need to have a different way to train healthcare professionals, both conventional, alternative. We have to have shifts in the insurance model, health policy to make the biggest change. So I don't have the answers with my online program or my book. I'm
Right.
just trying to, as an observer, go, hey, I have some information that you should know about, like maybe it can help you on your journey. But I spend most of my time actually treating, but working with healthcare professionals as an educator. So I have an institute called the Kharrazian Institute. We have about 3,000 physician healthcare professionals who are learning evidence-based healthcare. And I have like on the Kharrazian Institute website, I have a practitioner locator where they can find a practitioner if looking for someone. But it's complicated. And I think when people develop chronic diseases, they definitely need a personalized, individualized approach because all these variables and factors are involved, and you have to look at them. The classic model of medicine is you come in to get a diagnosis, and then there's a treatment, and the treatment is a drug, right?
All right.
And the model for alternative medicine is not really much better. You come in, you get the diagnosis, and now you get a supplement. I call that green medicine, right? So it's
Sure.
very linear, you know, diagnosis, drug, diagnosis, not drug, supplement, because supplement's safer, right? And that's what they think, and that's what they go through. But in reality, it's not a linear single variable. The diagnosis has multiple variables in it. Each of those variables expressed differently, so you have to look at all those variables to make the biggest change. And for some things, a single linear model is, of course, easy and it makes the most sense, like an infection, bacterial infection, antibiotic, perfect linear model. That's what you need. With chronic disease and autoimmune diseases, things like Hashimoto's diseases, things like traumatic brain injuries that are impacting the brain gut axis, all these other things, it's a multivariate model. And this is where you need personalized, individualized approaches. And that's what's difficult. And unfortunately, we have, insurance healthcare policy program where you can't have a healthcare professional spend 3 hours doing history on a patient.
No, I think there's a few alternative in other countries that are trying to do that, but it's not common at all in the U.S.
And there's some places like the Cleveland Clinic has a functional medicine center where people can get more personalized lifestyle approaches. And they just published a great paper, I think last year, Journal American Medical Association, the online version journal, where they showed outcomes between treating non-responsive inflammatory bowel disease with a conventional approach to functional medicine approach at the Cleveland Clinic with dramatic changes in outcomes. So there's some attempts to make some of these changes. I teach at Loma University School of Medicine, and we have a fourth year option class for medical students where they can learn individualized lifestyle medicine approaches, functional medicine approaches that many of them get very interested in. And the thing is these physicians too that are in training, like they want to know. They want to know, like, it's not this big conspiracy. It's a complex model. And to go from the linear model we have now to a complex model is slow and hard to do. And then also many practitioners, like just to get a different point of view, like I meet practitioners all the time going, hey, I've been practicing medicine as a family physician for all these years. I really want to do personalized lifestyle medicine. I just don't know how I can support my family if I do that. Because how much is it? If I'm doing a 3 hour history on a new patient and I can maybe see two of them in a day,
Right.
what am I going to charge them
Yeah.
to then be able to cover my office, my malpractice insurance, and my staff and everything else that's involved with expenses, and then have any money left over, right? So then you get in a situation where you have physicians with all the intent wanting to do all the right things. They just can't make the model work. It's very hard for them to make it work, right?
Right.
And then they can get insurance coverage for it. And then, like, what do they charge for the first appointment? Is it $500? Is it $1,000?
Yeah, it has to be somewhat reasonable for the clientele.
Yeah, and then so now you're kind of forced with a healthcare model where money becomes an issue because, like, the healthcare professional has overhead expenses and staff and all the things required to manage their case, right? Someone's got to help run the office and organize things and build appointments, and then they have to support their own family. And now you have this area where even people with the best interest are having a hard time doing this. So when you find them, they're all busy, and unfortunately, people that need them sometimes can't afford them, and people that can afford them can't find them, and it's a problem.
Yeah. Let's talk a little bit more. We talked about leaky gut a little bit. Can you get a little more in depth on it and what are causes of it?
Yeah, so leaky gut was something that naturopaths had in their training and terminology since the beginning of naturopathy, right? Back in the 1900s, they always believed you can have a leaky gut, which means your intestines have basically these like little microvilli and they open up. We just think of like holes in the gut. The intestines get inflamed and things open up. And that was kind of like a folklore thing that happened. And then a guy named Pisano identified the molecule that opens these things up. And then they were able to cause leaky gut in animals with the signaling molecule zonulin. Pisano's also at Harvard Medical School. He's in the gastroenterology department. And since then, it's like, okay, leaky gut's real. And now they're actually developing a drug that's in a phase 3 clinical trial to stop leaky gut.
Oh,
And I'm pretty convinced once they have that drug finalized and approved, which it certainly looks like it's going to be, then the whole world's going to be using the term leaky gut in conventional medicine, right?
yeah.
But until the drug's made, no one's going to talk about leaky gut in conventional medicine because it's not real yet, right? In the scientific literature, in the gastroenterology field, immunology field, autoimmune field, there's tens of thousands of papers on it. They just don't call it leaky gut. They're starting to now. They just use the term intestinal permeability.
Yeah.
Right?
I think I heard it like 5 years ago or so was the first time I heard leaky gut. but
Yeah,
I think it's getting a little more mainstream now.
it's starting to get a little bit mainstream, but it should be like breaking news. Like this is really important. This is linked to many chronic diseases, inflammatory diseases, brain gut axis, inflammation, um, chronic diseases, cardiovascular risk, predictive models for uh, strokes, heart attacks, all types of things, right? So survivability in the hospital, these are all linked to potentially to intestinal permeability. Long COVID now linked to intestinal permeability as one of the variables and factors. So we all have this potential in our lifespans to have our guts develop permeability, or think of it like as holes being opened up in the gut, and then healing pretty quickly. And some people have leaky gut that stays ongoing because their diet's terrible, right? Now you can cause leaky gut really easily with people, and you can just cause leaky gut by the standard American diet, which is very high in fat, very high in sugar, very inflammatory foods,
Yep.
processed foods. That's guaranteed. If you wanted to create a human study to cause leaky gut, put them on the standard American diet. You'd see a lot of them have leaky gut. But really, what prevents leaky gut is having microbiome diversity, like exercise. It changes your microbiome, movement, fibers, like people that have to eat vegetables, different fibers. The more diverse your fibers are, the more probiotics you have, the more microbiome diversity you have, less likely to develop leaky gut. Um, the less processed food, inflammatory foods a person eats, these all things protect the gut from not developing the so-called permeability, this leaky whole gut pattern, right? Now you take someone who just eats processed food, doesn't eat vegetables, um, doesn't move, is sedentary lifestyle. I mean, they're likely to have intestinal permeability. Now, a lot of people get leaky gut, but that's not necessarily what causes all the problems. So when you get leaky gut, there's a few things that happen. There's when you look at the gut, the very top is just a lining of the gut barrier. Okay. And underneath the gut barrier down here is a part of the immune system, the gut immune system. And underneath this gut barrier here, you have things like natural killer cells and T cells, and they're ready to respond to anything that's foreign. Okay. So normally your intestines have these little tight junctions, like very narrow, that little digested food particles can go through. But if there's holes and the guts open up, then undigested food particles can just go through the gut. So normally if you eat something, you're going to have your enzymes break that down from proteins to peptides to amino acids, and then they're small enough where the molecular weight's very, very small, so they can go through those little tiny holes in the gut barrier. But when you get leaky gut, these undigested proteins go through, and the immune system starts to react against them and starts to make antibodies against them and starts to react against them. And this is where people develop food sensitivities. So one of the most common presentations people start about leaky gut is they're like, hey, I'm starting to get bloated and distended and feel awful with all these new foods now that I used to be able to drink milk, and now I can't drink milk. Whatever the things are.
Right.
And that's where their gut barrier opened up. There's undigested food particles. Immune system starts to react to them. You do a blood test, you'll see antibodies against these food proteins. Immune system has definitely developed not an allergy, but a food sensitivity, right? They're not going to have
Right.
anaphylaxis from it and can't breathe, but they can get inflamed from it. So that's the difference between allergy and food sensitivity. So they develop food sensitivities. And in a clinical model, we measure food sensitivities with what's called an IgG antibody, which is different than an allergy, which is IgE, right? So intestinal permeability and leaky gut develops food sensitivity, okay? And these food sensitivities then get more progressive and they're inflamed. They eat something that they normally eat all the time, like milk in their coffee or whatever it may be, if it's dairy or something you react to. And all of a sudden their body's inflamed. Now these immune systems in the gut create inflammation. These inflammatory mediators get into what's called the mesenteric plexus in the gut, and then they spread all throughout the lymph nodes in the body. Now there's inflammation throughout the entire body. Now they have pain in their joints, they have pain in their limbs, their back injury is now flared up, their brain injury they had years ago, I don't know, playing volleyball or football or something, is now reactivated. These inflammatory cells are turned on now. They have their neurological symptoms again. They can't focus, they can't think. Well, for some people, their Hashimoto's turns on, and more of their immune system starts to attack their thyroid gland. So that's the model of leaky gut. These intestinal permeability patterns where these holes opens up, things that get through, the immune system reacts against them, this inflammatory response becomes systemic, and that triggers on these adds fuel to the fire wherever the fire is. So that's leaky gut, and you can test for it. You can measure things called zonulin to see if you have it. You can check things like zonulin antibodies, and the worst part of it is something called endotoxemia, which is where leaky gut gets really, really bad. So let me explain that too. This is important. When you look at the gut barrier, some people may have heard the word dysbiosis.
Yeah.
Biosis being bacteria, dys being dysfunctional. So dysbiosis means you have more bad bacteria than good bacteria, right? So if you eat unhealthy for your gut, meaning you don't have enough fiber, you don't have enough plant foods, and so forth, right? And you have a lot of processed saturated fats and all these things, you can then develop dysbiosis, right? So sodas and fast food all the time and no real vegetables is going to put someone's bacterial populations to have what are called more unhealthy bacterial populations. And these unhealthy bacterial populations basically, remember we talked about bacteria in the gut releasing molecules like signaling agents like serotonin, dopamine, or GABA. Well, they release inflammatory chemicals. That's why they're bad. Okay, so this change in dysbiosis, where you have more unhealthy bacteria, unhealthy being they create more inflammatory messengers that cause inflammation out the body. They're in higher proportions. Now, if someone has leaky gut, those signaling molecules get through and they get into the bloodstream. Because as soon as they get into the gut has a pathway called the mesenteric plexus, which is a pathway for it to get into the entire lymph nodes throughout the whole body. So now these signaling molecules that cause inflammation in the gut get into the bloodstream, and it's known as lipopolysaccharide, gram-negative polysaccharide, LPS. Then LPS gets into the body, and throughout the body, we have these immune receptors called toll-like receptors. There's one called TL4, toll-like receptor 4, and these LPS gram-negative bacteria bind to them. And as soon as they bind to them, they cause inflammation. So there's papers showing that people that have endotoxemia, like leaky gut, with this like you can measure it too. You measure blood LPS. You shouldn't have this bacteria in the blood. Okay, if you do, it's called endotoxemia. So you should measure that, and that's high in the blood. That's been linked to cardiovascular disease because it destroys the blood vessels. It's been linked to major depressive disorder where they can't get out of depression. They won't respond to any of the antidepressants. It's been linked to triggering autoimmune diseases throughout the body. It's been linked to chronic pain, fibromyalgia, all these various things. So this is why, like years ago, like someone would go see a naturopath to go, I'm really, really sick. They're like, we're going to get you off all bad food. We're going to put you on a fast. We're going to give you some things to support your microbiome and gut. And these people did this, and all these anecdotal stories, like, oh my God, they reversed my inflammatory condition. The first time in my life, I felt better. And back in the 1900s, naturopaths were doing this all the time with like that's obvious. But now I think medicine's science is definitely caught up, but medicine is now trying to work on a blocker. It's not gonna, and that's only gonna work on selected types of leaky gut. Not to get too detailed, but it's still gonna be very beneficial to many chronic diseases when it comes out.
How common is leaky gut? Like, do you have a 1 in 4 people or something, like some stat, or no?
So here's the thing. There haven't been studies where they looked at a healthy population and they go, okay, this percentage of people, so it would just be a guess. Okay?
Yeah.
And then when you talk to practitioners, they're not seeing regular parts of the population. They're seeing people have symptoms, right? So they're not feeling well, so they're going to see them. But I'm going to guess.
How many people do you see for leaky gut? I guess it'd probably be a better question.
Well, I work with autoimmune disease patients a lot, so it's the majority of them, but it's not all of them. Not all of them have it.
All right.
And I would say, yeah, I mean, you could easily guess 1 out of 4, 1 out of 5. Now, if you have symptoms of bloating, distension with more and more foods, if you eat foods and you feel inflamed, if your body hurts all the time, and when you take a break from certain foods, that's a clue you may have leaky gut. If you've ever gone on a fast and you feel a lot better and your body doesn't hurt, you're not as inflamed as much, that's a big clue you might have leaky gut. Because the main trigger to leaky gut is going to be dietary proteins.
Okay.
So what's going to trigger leaky gut is there's holes in the gut. Food proteins that aren't digested are going to get through, and they're going to trigger the immune response to cause inflammation. So when you see significant reactions to foods, whether foods cause massive brain fog or cause massive bloating or cause massive distension or cause massive joint pain, that's a strong indication you have leaky gut. Because normally food proteins shouldn't be such an immune trigger, right?
Right.
Yeah.
I know it's a little different because FODMAP is based off fermentable carbohydrates, but does FODMAP foods relate to leaky gut?
No, FADHAP's a different mechanism. There's another condition called small intestinal bacterial overgrowth, and what
Right.
happens in that condition is bacteria, like we have these bacteria in our large intestine, the microbiome, and we have some bacteria in the small intestine. What separates the small intestine and large intestine is a valve called the ileocecal valve. And what happens with small intestinal bacterial overgrowth is bacteria from the large intestine moves into the small intestine through this valve abnormally.
Oh, okay.
And now these bacteria species are in the small intestine that shouldn't be there. And these bacteria immediately respond to fermented foods and sugars. So people that have FODMAP, as soon as they eat any kind of sugars or fibers, they get severe distension and bloating because they have bacteria that feeds off them in their small intestine that shouldn't be there.
Right. So it's still okay. There's
It's
still
different link.
bloating and distension of the stomach, but
Yeah.
different mechanisms.
Yes,
Okay.
but many people with small intestinal bacterial overgrowth have been shown to end up with leaky gut too, because those bacteria that are in the small intestine do create an inflammatory response when they're triggered by food, since they're getting exposed in that early state to them.
Right.
So you get a combination of both.
Okay. Yeah, I have experience, and so does Bob with FODMAP because I had a lot of brain fog and gut distension before I cleaned my diet up a lot.
Yep.
A lot of the stuff you mentioned is relatable for me.
Yeah, I mean, you're not alone. We get older, or we lose our brain cells. We get more neurodegenerative. We lose some of our brain gut access. Our immune system starts to age. We start to lose our immune tolerance. We start to react to different things. But these are things that then make us sick, and then makes us have symptoms. And then, like, yeah, at some point in your life, you may have to make some dietary change of how your body's responding to function better. At some point in your life, you may want to take some nutraceuticals, whether it's anti-inflammatories or something else. Like maybe you want to, take things to support blood flow and circulation because your vascular dynamics are changing. Or at some point, you may want to do these things to function better, right? And this is where the world and field of functional medicine came in. The world of functional medicine is another specialty in healthcare. It's one that I'm involved with, and it's like, okay, we're not disease focused. We're focused on function. What's not functioning for you? Well, I get bloated and distended all the time. Great, let's figure out why.
All
You
right.
know, yeah, you have bacteria in your small intestine. It shouldn't be there. You have SIBO. Let's put you on this diet. Let's see if we can change your let's see if we can change your microbiome richness and diversity. Let's measure it, see what your bacterial populations are. Let's see if interested foods in your stool. Let's see if you need to take some enzymes. And the goal is really just to improve a person's function. So another person may come in, they may have like fatigue and shakiness and lightheaded and irritability throughout the day, and then you find out, okay, well, what's your function? You're not functioning well. Your energy levels are fluctuating, and guess what? You're hypoglycemic. You're going too long without eating, and you can't have a smoothie for lunch. It's way too much simple sugars. So now you're crashing. Let's have you add some more fiber and protein, and that goes so long without eating, and then all of a sudden their function comes back, and now their depression, anxiety, and fatigue is all gone. But they didn't get a drug for depression. They get a drug for anxiety. They just fixed their blood sugar problem.
Right. They're
That's,
looking at the origins instead of treating symptoms.
yeah, and that's the world of functional medicine.
Let's talk about what are some signs of brain inflammation and what should someone do if they have that?
Biggest sign of brain inflammation is brain fog, and brain fog is a term that's used where you just can't get to your thoughts. So you can't find the words you're looking for. You can't get to the memory that you're trying to get to. And the best way people explain it is that's fogginess. It's just slowness. And really, what's the mechanism behind that is there's what's called impaired nerve conduction velocities. So when there's inflammation in the brain, neurons, the messengers from one neuron to the next, that's called nerve conduction. It just gets slowed. So inflammation slows down nerve conduction. Okay. So now someone has an inflamed brain and their neurons are just slower. They're firing slower. So now everything's hard. Everything's difficult. They can't get to their thoughts. They can't think. They can't focus. And if it gets bad enough, you can get depression. Like most of the current research is showing, severe, massive, unresponsive depression is really brain inflammation. And this brain inflammation also not only shuts down nerve conductance, it disrupts neurotransmission signaling pathways in multiple mechanisms. It changes something called plasticity potential, where different growth factors of nerves get shut down during this inflammatory state. And it really sets up the stage for neurodegeneration. So your biggest clue you have brain inflammation is you have brain fog. And you could have brain fog for various reasons. You could have brain fog because you have food proteins causing it, the gut-brain axis, right? Because they're like that. Um, you could have brain fog because you have Hashimoto's, and antibodies produced against the thyroid gland also have been shown to bind to the brain, the cerebellum. Like that's cross-reactive antibodies. Get brain fog. So immune system flares up, you have that. You could have had a past head injury, and you had a past brain injury that turned on these inflammatory cells in the brain called glial cells. And now you didn't sleep well for the past 2 days. Your immune system is dysfunctional. You're more set to inflammation. And now you have brain fog. So all these various things. And if you have brain fog all the time, or the sensation of your brain speed is just getting slower and slower, then that's a problem. And that's an indication for mechanisms that can lead into neurodegenerative disease and also for sure depression.
How long does it normally take for the brain inflammation to resolve itself?
It can resolve itself in hours. It can resolve itself. It can never resolve itself, depending on what's happening. So within the brain, you have cells called neurons, and you have another group of cells called microglia. And these microglia are the immune cells of the brain. And actually, the brain has more microglial cells than neurons. So the brain is more immune cells than brain cells. Okay. And these microglial cells, they're the ones that create inflammation, but they can also turn off inflammation. And they have a pathway called M1, which turns on inflammation, and a pathway called M2, which turns off inflammation. So some people, we all get things that cause inflammation in the brain every single day for various mechanisms. Things cross our blood-brain barrier on a regular basis. They can turn on inflammatory responses. But for immune system in our brain's healthy, these M2 pathways turn on their anti-inflammatory, and you don't notice anything. But sometimes the inflammatory load is so much, like you get leaky gut, you have so much inflammation, you have dysbiosis, you have lack of microbiome diversity, and you get these bacteria that produces all these inflammatory mechanisms that get into your bloodstream and even go up directly to your vagus nerve and your brain gets inflamed. And the M2 pathway doesn't have the resiliency to turn them off, and now you have brain fog. And maybe you might have it for a day or two, and finally the M2 pathways kick in, and then they can turn it off. And maybe the trigger goes down, and a combination of those two can take place. So it's devastating for some people. Some people that have these neuroinflammatory responses, they just can't function when they get into that inflammatory state, and sometimes for days and days, and sometimes even longer. Yeah.
So I would like when I got brain fog, mine was due to like hypoglycemia, pretty much. My blood sugars were because I was discovering my fasting blood sugar was getting a lot more elevated. So like pretty much I just went, low carb and then it fixed that. But I mean, that's just for me.
Yeah. And that, you may have just had lack of fuel for your neurons. So it may, so you're not having nerve conduction speeds turned on by inflammation. You just may have had not enough fuel to keep those neurons active.
Okay.
Yeah. So you may have just been hypoglycemic. But when you lose cognitive speed, it's not always brain inflammation. Sometimes it's exactly like you said, hypoglycemia, or you have drops of blood sugar levels there. But it's usually lack of blood flow, lack of glucose, like blood sugar, or an inflammatory response. Those are the main ones that cause that brain fog pattern.
Okay. All right, let's get on to the last topic. This one's for Bob. So when should you go gluten-free?
When you react to gluten.
That's a good answer. How do you know if you react to gluten?
You can do a test. You can do a lab test. Okay, so let me get into that. So gluten-free, first, it's like trendy now, and just because people dismiss it as this a new trend, it's not real. It's very, very real. Gluten sensitivity. So first of all, let's talk about a couple of things related to gluten. There is a serious area of investigation in gluten in the world of real researchers looking at answers for chronic inflammation and celiac disease. And one of the first things that they wanted to look into is a group of researchers did is they wanted to see, is gluten-free more popular now because it's a trendy mechanism, or is it have our bodies actually changed? So this group of researchers went to Warren Air Force Base and they got blood samples from soldiers, 10,000 soldiers from 1960. They matched age controlled, gender controlled for the same population they could get as close to now. They looked antibodies to gluten back then to now, and there's no comparison. There was a 404-fold increase risk of gluten reactions now than before.
Jeez.
And other similar studies have been done like that, where they can get these other blood samples from years ago and compare them to as close as they can to the population now and see that. So, number one, it's not it's more popular now, so people are being tested. Something's happened, right? So then other researchers go like, well, what's happened? Why is gluten an issue? What's happening? What's different? So there's a whole bunch of different theories. One of them is gluten is different now. So wheat proteins are different. They're different than, let's say, when you were your kid, like 20 years ago, 30 years ago, right? You had that bowl of Wheaties back then. The bowl of Wheaties you have now are not the same. Okay. So one of the mechanisms is gluten proteins have changed. They changed through two different mechanisms. One mechanism is that they have been wheat strains have been hybridized. So it's not GMO. It's just that they're mixing different strains of grains together so they can avoid weather, they can avoid insects. But the new strains are much more immune and reactive. Immune reactive means the proteins are changed where they can trigger inflammation faster than proteins. And in the immunology literature, they actually use the term native wheat to modern wheat because of the significant change in proteins.
Oh.
Okay, so they're saying that they can actually do protein spectroscopy, see 5% or more protein difference changes. So they use those terms. And there's researchers that have gone to like Middle East and areas of Nazareth and looked at wheat there to modern wheat, totally different protein. Protein triggers, wheat protein. I'm talking about wheat protein. Okay. The other theory that's come up is how we process wheat with pesticides. And there's a concept in immunology called haptenation. That's where a chemical binds to the protein. So when the chemical binds to the protein, it changes the structure of the protein. And there's some theory that pesticides, specifically glyphosate is one of the most commonly used ones, bind to the protein and change the structure, which makes it more immune reactive. And then there are researchers that have published like the rise in celiac disease with the use of glyphosates in farming practices. So I mean, directly linear, like matching each other. You put them on top of each other, superimposed on each other.
Right.
So there's possibly there's some haptenation, meaning chemicals. Some of the new pesticides are binding to the wheat like never before, changing the protein structure. Hybridization, when these proteins are different. But very clearly, without any theory, there are different protein structures to modern versus native wheat. So this new modern wheat is much more inflammatory. Okay, so that's like one difference. And because of that, people that have always eaten bread 20 years ago, 30 years ago, and they get older, they think they can still eat it now. Well, it's not the same wheat. So you might react to modern wheat versus native wheat. Now, another common thing is there's much more native wheat in Europe than there is in the US. So a common thing everyone hears about, it's very common, is like Americans go to Italy and go, hey, I had all the pasta. I didn't feel bad. I felt great. I came here, had a bowl of pasta. I felt awful. And then vice versa. Europeans, when they come to the US, many of them immediately go gluten-free because they feel sick when they eat the wheat here.
Right. Okay. Yeah, I've heard that before. Europe, they don't have organic because everything's organic.
Yeah, they don't
label stuff that way. They don't use like pesticides and things either.
Well, and even when they use pesticides, they don't use the severity. Like here in the US, they like soak the fields with pesticides for weeks, then they use the same fields over and over again. It's just they don't have the same practice of how to use pesticides, even if they do. And then many countries like Japan and I know different European Union countries, they just ban these pesticides altogether. They're not even allowed. So that would explain more of the haptenation mechanism where the chemicals are changing the wheat structure, the pesticides changing the wheat structure. So there is a new wheat. And then the other thing is we have a population of people that do have gluten sensitivity genes that are very common. So there is what are they called gene types. We have different genes, and there's gene types for T cells or immune response, and they're called HLA-DQ gene types. And HLA gene types 2, 6, 1, and 4 all make you at risk for gluten reactions. And about 1 out of 4 people have those gene types.
Oh.
So when you have 1 out of 4 people with these gene type susceptibilities, and now you have a new wheat, you see an explosion of gluten sensitivity. So I think that's part of the reason why you see so much gluten sensitivity now. And why people have noticed, hey, when I get gluten-free, I feel better. My inflammation goes down. I don't feel as bad. Or my kid ADD completely changes or whatever the scenarios may be. They're all over. It's every spectrum of disease and conditions because it just causes systemic inflammation. So it's possible that you may want to be gluten-free, especially if you notice you react to gluten. Now, the problem with gluten is it's in many things. So some people go, well, I tried gluten-free diet. I didn't feel any better, any difference. And they didn't really understand like the soy sauce they're using still has gluten in there. The beer they're drinking still has gluten in there. They just think it's bread. They haven't really done a gluten-free diet. So that's one reason. The other thing is the laboratory testing for gluten is also limited because when you look at gluten is like a protein. And this protein, think of it as a tree with different tree branches. There's alpha gliadin, there's gamma gliadin, there's deaminated gliadin. You can react to any one of these different gliadins. And in the conventional gastroenterology testing world and what medical labs are conventionally doing, they're only measuring the alpha 17 mer gliadin, which is the most popular one, but some people may have a gamma gliadin reaction and never show up positive for it. So another part of why people don't know they're gluten sensitive is they do testing, but they haven't had the whole spectrum of the proteome, the protein gluten checked. They only had one branch of it checked. So they just and the doctor goes, hey, we don't have gluten sensitivity. We tested it. They're like, no, you didn't test all the branches. You just test one.
Right. Yeah, I would never have known that. I mean, I've heard of people getting, gluten sensitivity tests and they're negative, but then,
This is what I'm saying. It's so frustrating because when you see, like, once you know some information, like from my perspective, people have no chance because they're going to the healthcare field even with full blown gluten sensitivity, and they're only getting this alpha 17 more branch checked because that's the most common for celiac disease. But some people don't even have celiac disease. Celiac disease is a different form, more severe form of gluten sensitivity. They have a specific HLA-DQ2, HLA-Q genotype of 2 and 8, which makes their T cells very, very reactive. Their immune inflammation is very, very reactive to gluten. And that's the difference between gluten sensitivity and celiac disease. It's just how what their gene type is and how they respond to gluten. If it's very, very severe, that's celiac disease. And that's done with a gene test. They do a gene test for that.
Right.
But in reality, a lot of people have reactions with gluten, and the testing sometimes is flawed, and sometimes they just need to go and learn how to do a complete gluten-free diet for a good 10 days to 2 weeks. Usually by the day 3 or 4, they'll feel better if they have reactions to it, and they'll go through it. Now, in the world of food sensitivity testing, the gold standard is not a blood test. It's actually elimination provocation. You eliminate the food and then you provoke yourself. The problem is you have to go follow a strict gluten-free diet. And if you're not familiar with it, just look online. There's lots of sources, strict gluten-free diet, and then follow that, and then see if your symptoms go away. And for some people, it's life-changing. That's the key thing. So that's why. So should you go on a gluten-free diet is your question, and the question is, well, if you react to gluten, you should. But if you have a chronic inflammatory condition, autoimmune disease, leaky gut, it's very likely you'll have gluten sensitivity.
Right. And if you're just curious, you just go gluten-free. And if it doesn't bother you, you just did an experiment.
Exactly. But you have to do it strict for a good 3 to 10 days.
Right. That's not that long.
It's not that long.
All right. So where can people find you at on your websites, and where can they get your books?
So my website is Dr. K News, drknews.com, Dr. K News, because my last name is Kharrazian, and that's really hard to spell. So I use Dr. K News. And then I do have free content on that, including a gluten and the brain book. So if there's a free online gluten and brain book, if you want to check that out if you're listening. And we have lots of podcasts and videos and information trying to educate the public. And the goal of the website is to educate the public and let them eventually know about the books I've written. I've written 2 books, one on the brain, one on the thyroid, and we have some online courses on the brain, thyroid, food sensitivity, food allergies to try to get information out to people. But hopefully it can be a good educational source for those that are interested in these topics.
All right. Well, thank you for joining us.
Okay. Thanks, Mike. It's a pleasure, and talk to you soon.